Hello and welcome to World Info Nexus. I am Sukant Chaudhary. On Wednesday, the World Health Organization declared Mpox a public health emergency of international concern, a decision that underscores the escalating crisis surrounding this disease. The declaration came after an urgent meeting of the WHO Emergency Committee, which advised Dr. Tedros Adhanom Ghebreyesus, the WHO Director General, that the situation required immediate global attention. Today, it was announced by Dr. Tedros during a media briefing that a public health emergency of international concern was constituted by the situation, according to the view of the emergency committee. The advice that was given was accepted by him, marking a serious escalation in the global response to Mpox. In the United States, there have been 1,634 reported cases of Mpox so far this year. According to the US Centers for Disease Control and Prevention, this number is more than double the cases reported at the same time last year. Although it's still lower than the peak numbers seen during the 2022 outbreak, the US is not currently facing the same level of crisis as seen previously. But the situation in Africa paints a far more alarming picture. Mpox, which is endemic in parts of Central and Western Africa, has seen a dramatic rise in case in the Democratic Republic of the Congo. This year alone, the DRC has reported over 14,000 cases and 524 deaths. The crisis has been exacerbated by the emergence of a new variant, Clade 1b, which is spreading primarily through sexual contact and appears to be driving the current outbreak in the DRC. The rapid spread of Clade 1b has been alarming, with cases now detected in neighboring countries that had not previously reported Mpox. Burundi, Kenya, Rwanda, and Uganda are all grappling with this new strain, prompting Dr. Tedros to convene an emergency meeting. The detection and rapid spread of a new clade of Mpox in eastern DRC is detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. Tedros stated, emphasizing the urgency of the situation. In a parallel move, the Africa Center for Disease Control and Prevention declared Mpox a public health emergency of continental security on Monday. This marks the first such declaration since the agency's inception in 2017, highlighting the severity of the outbreak. The WHO's report from June revealed 934 new laboratory confirmed cases and 4 deaths across 26 countries, illustrating the ongoing global transmission of Mpox. Despite this, there have been no reports of Clade 1 Mpox outside Central and Eastern Africa, including in the US. The CDC has assessed the risk of the types circulating in the DRC as low for the American public at present. To combat the outbreak, the Genius vaccine, approved by the Food and Drug Administration for preventing both smallpox and mpox, is currently in use in the US data, and Africa indicates that 2 doses of Genius are at least 85% effective in preventing mpox infection, providing a critical tool in managing the disease. As the world watches the situation unfold, the WHO's declaration of a public health emergency of international concern and the Africa CDC's continental emergency highlighted the urgent need for global cooperation and swift action to curb the spread of this evolving threat. What do you think about this health emergency? Share your thoughts in the comments below. If you enjoyed this video, please like and share it. And if you're new to our channel, don't forget to subscribe. We'll see you in the next video with more updates. Until then, thank you for watching.